Hey, this is Dr. Habib. People often ask me about the current healthcare system. So my question really is, do we have a healthcare system or a disease care system? That's the question. So let me propose something to you. There's a few problems. The problems start with how we do the treatments right now. Are we fixing it or are we managing it? So one of the things I'd like to tell people is that if you're on your blood pressure pill, your cholesterol pill, or your diabetic pill, and you stop the pill, did the problem go away? Did you just control it? And then I have more important things to say. For example, as it stands, 1 in 2 women have osteoporosis, which is pretty dramatic. But did you know that 1 in 4 men have osteoporosis? That's pretty horrendous. However, what may be even more telling is that with the best treatment that we have, like controlling blood pressure, blood sugar, high cholesterol, you'd expect to reduce the incidence of heart attack by a significant amount. We only reduce it by 25% in secondary prevention. And what might really open your eyes is that, if you do a stress test, you expect to find blockages, but the stress test is only positive when you get greater than 90% block. Well, those are the problems. So, the way I practice medicine is a little different. If I do what every other doctor does, I can't expect better results. So what I have to do is rethink medicine. And that's why in Next Health, I believe in total health. Total health to me means everything from wellness, illness, and everything in between. And so let me propose something. So if you have something that's 70% effective, that sounds very, very good. But what if you're the 20%, 30%? However, what if you have something that's 95% effective, but you're the 5%? Well, there's the problem right there. Is it personalized medicine that we do? So at Next Health, what we try to do is identify these variations. And instead of you just being a number, a percentage, what we try to do is evaluate your personal parameters with the Next Health Executive Physical. It's really just a primary care practice, but a nice one. One where we give you great service as if you were in concierge service, but that's not good enough. We have to differentiate ourselves. That's where that Next Health comes into it. The Next Health Rethink Medicine is seeing what every doctor sees, but only thinking what no other doctor thinks. And so, is that really important for you? Well, I propose to you, what's important for you is that you want more energy, you want to burn fat, you want to have your optimal hormones, have great mental focus, and have lots of endurance. Well, how do we do that? That's the Next Health way. We have to reprogram the cells, stimulate stem cell regeneration, as well as repair and revitalize health. And we do that with the Next Health way, which is the right treatment for the right patient at the right time. These are the essential things that will identify the link between heart disease, brain decline function, as well as cancer. And amazingly, understanding those links and knowing how to alter the signals and start to regenerate, repair the body, you can actually prevent and cure many of these problems.